Okay, good day and welcome to all joining. My name again is Tanya Govender, and today, together with my colleague Farai Matero, we will present to you the use case of how we utilize the human resources for health registry, together with other components through interoperability to provide a human resources for health solution to the Ministry of Health in South Africa. So just 3.5 months after the start of the coronavirus pandemic in Wuhan, China, South Africa confirmed its first coronavirus case in March 2020. And shortly after that, our president, Cyril Ramaphosa, declared a national state of disaster, announced immediate travel restrictions and the closure of all schools. A national coronavirus command council was established to lead the nation's plan to confirm the spread and to contain the spread and to mitigate the negative impact of the coronavirus in South Africa. Immediate questions from the National Coronavirus Command Council were regarding the workforce that would take care of our sick, requiring information of how many healthcare workers do we have in each facility, and also being able to identify where our specialists are. For example, our intensive care health workers. To support the procurement and distribution planning, there was an urgent need to know how much personal protection equipment would be required and where that stock would need to be directed to. As the virus spread through the country, the number of infected healthcare workers were rising rapidly. We needed to respond to questions on where the infected healthcare workers are and how can the remaining staff be redistributed to continue attending to the sick. South Africa received its first batch of vaccines in February 2021. And the rollout commenced shortly after, with the priority to vaccinate all healthcare workers. The vaccine rollout planning required us to respond to how many vaccines were required for all the healthcare workers and where the vaccines would need to be distributed to. To respond efficiently to these requests, I would like to introduce you today to South Africa's Human Resources Information System and how, through interoperability, we were able to pull data from multiple data sources together to get the answers that we were looking for. So in South Africa, we were not starting from scratch. We had actually long been planning on how we manage the health workforce more efficiently and effectively. And this process began with the concept of aligning the Human Resources Information System with the National Department of Health's Human Resources Strategy. And the strategy can be summarized into these 5 areas. Effective workforce planning for current and future needs. Institutionalized data-driven policies for planning. Having a competent and multidisciplinary health workforce, ensuring optimal governance in leadership and management, and building a productive and empowered workforce. The system that supports the human resources strategy lives within an integrated ecosystem of multiple contributing components. Here's an overview of those components. The first component is the Human Resources for Health Registry, and this is our authoritative repository of all the healthcare workers in South Africa. Followed by the second component, which is the Human Resources Warehouse, and this is where all the aggregated data from the registry sits, and this is used for planning and reporting. The third component is created using a web app, and it's our Human Resources for Health portal, which is the web interface for users to engage with the data for management and planning. And the fourth component is a custom app that is currently being developed by HISP South Africa. It is our Human Resources Planner module, and this will be utilized to create scenario-based and use case planning and predictions. So the current system is still quite flexible. It allows for additional components and further interoperability channels. Now, to date, we currently have just over 1 million records in our registry, which is updated monthly or quarterly. And this is really an achievement on its own. But the real exciting part lies in the fact that we are now using this data and the system. So we have staff from national and provincial levels that have been trained on how to interact with the system. We are generating reports on the health workforce at different levels to support planning. And the National Department of Health even requested that the Human Resources Registry be the authoritative source for all healthcare workers that are registering for vaccinations on the vaccine database. There's many values to the HRIS, and in addition to obviously being aligned to the National Department of Health strategy, the real value lies in having quality information at your fingertips for informed decision-making, planning, and reporting. It's the ability to respond efficiently to a pandemic or a parliamentary inquiry. By improving service delivery through these informed decisions and planning, we are ensuring better, healthier lives for the people of South Africa. I would now like to hand over to my colleague Farai, who is our senior software engineer, and he will be taking us through the HRIS architecture and interoperability. Thank you, and over to you, Farai.
Thanks, Tanya, and good day to everyone on the call. Now, the current slide that is displayed here shows a simplified view of the HRIS architecture. I'll be presenting the architecture by going through the information flow across its different components. So I'm going to start by looking at the primary data sources. We have inflow of data coming in from different primary data sources, which includes a government payment system with records of public sector personnel, also got statutory councils and the private sector. The inflow data is basically demographic information about individual health workers. The next component is data cleaning, automation, and the ETL process. We have a staging platform which is responsible for two major processes. The first is the processing of inflow data, and the second is data aggregation for reporting. Now, the preferred way of receiving data from primary data sources is in HL7 file format. However, the HRIS system is able to receive data in any digital format. This capability is achieved by establishing the activities required for cleaning and transforming source data into file resources, and then automating those activities using Apache Airflow, which is an open ETL tool. Now, looking at the data repositories, the data sits within the HRIS system at different levels of detail. The HRH registry stores a detailed view of a health practitioner record consolidated from data coming in from different primary sources. The registry is implemented using HappyFire, which is an open source file server. Now, to show you an example of a fire message, the following is an example of the fire practitioner and practitioner role resources housed within the HRH registry. The resource lengths and details have been shortened for display purposes. And now going back to our main slide, the HRH data warehouse, which is denoted by the second green icon, stores aggregated data for HRH planning and reporting. Now, to give you some insights into this component, what you see here is the aggregated data shown on the dashboard. We can create, edit, add, or remove favorites on the dashboard as required. So going back to our slide, other databases used in SA, and these are the ones denoted by the three last icons on the right. These are part of the HRH architecture, such as the National Routine Database, the Master Facility List, the COVID response systems, training information systems, and others. Now moving along to interoperability. The interoperability component provides access to the HRIS system for interoperability. It is implemented using OpenHIE. For COVID response, we establish interoperability with the SA COVID data lake to determine health workers affected with COVID. We also connected with the vaccine registry to provide a list of all health workers in the country who are eligible for vaccination. Now moving along to reporting, BI and the user interface. The interoperability component is also used to manage outflow of data from multiple repositories within the HRIS system. This can be for reporting, querying, and application development. Reporting on HRIS is done in multiple formats. We've got the DHIS2 data visualizer and dashboards for aggregated reporting. Now looking at an example of a dashboard component, this is an example of a DHIS2 favorite. When we have a request for analysis, we create the favorites first in order to finalize the details of the report before publishing it on a dashboard. We use BI solutions for more advanced reports on both aggregated and granular data. We are currently using Power BI. So just to give you some insights on what you're doing on Power BI, what you see here is a report prepared in Power BI. We have pulled HR data for doctors, nurses, and pharmacists from the HR warehouse in DHIS2, and also pulled data from the routine database on patients on ART treatment using the API mesh. So it is not necessary for us to push data from different systems into the warehouse. We then calculated an indicator that shows the number of ART clients per medical officer, nurse, or pharmacist. Once we're happy with this report, we'll publish it on the web portal. Now, the web portal, which is the last component, is a custom app developed using leaflets and custom graphic libraries. It is installed on the HR data warehouse. Now, what you see here is an example of the data on the web portal. This specific report shows health workers at the country level by occupation category. Navigation to lower levels is possible through the hierarchy on the left. Now, moving along to the data lake and the HR planning module. A feature HISP has started developing is an HR planning module. This will facilitate scenario planning from a current state to a future desired state. And it will stipulate what is the inputs or the processes required to reach the desired end state. This will assist the ministry to establish effective health workforce planning to ensure alignment with current and future needs. It will also institutionalize data-driven and research-informed health workforce policy planning, management, and investment. This concludes the overview of the HRIS architecture. So looking at the future, we're currently working with primary data sources to improve data quality. We are also still developing the HR planning module. We are looking to develop machine learning and predictive analytics models to facilitate future planning. And we are planning to work with stakeholders to enhance analytics outputs to facilitate better insights and planning. And finally, we are moving towards enabling the Ministry of Health to reach each HRH strategic goals. This is the end of our presentation. Thank you all for your attention. Back to you, Tanya.
Thank you, Farai. And thank you to the community for the awesome opportunity. Please do connect with us if you would like to engage outside of this platform. Back to you, Dana. Thank you very much for the opportunity.